So good morning. We're going to go ahead and get started to people in the room. And I know we have quite a few people either joining us online already or planning to join us online. So many of you know me. And so for those of you who do, you'll have to hear me repeat some of what I'm going to say this morning, but I have a little to add to it. So obviously did my training here in the Houston Medical Center. But before that training happened, I'm going to share something that I hadn't shared before, and that is that my twin sister, we weren't really twins, we were 18 months apart, but she had just given birth to her second baby. It was 2001, and her husband got the diagnosis that he had a non-Hodgkin lymphoma. And so I have sat on the side of watching a sister not sure if she would raise her children alone, and sat on the other side where we're now celebrating over 20 years disease-free remission. And so I know what it's like to be a family member of someone with cancer. And then in 2024, I was diagnosed with an aggressive squamous cell carcinoma. Have a tiny little scar on my chest. They thought it was going to be related to a head and neck cancer. So we went through a couple months of really intense concern. I'm totally through that. It's not a problem, but I'm just saying there's a personal aspect for me to keep showing up here year after year, driving what we're doing, bringing these key conversations. But I couldn't do it without so many people. I couldn't do it without Methodist Hospital Research Institute or Baylor College of Medicine, who, the many professors who believed in teaching me what it looked like to standardize things, look at numbers. I always, this time of year, call out Lisa Gregg for talking me into being the first PhD hired by BD to come and sell, because she bore witness with what would it look like to standardize flow cytometry. My time working with David at Methodist Hospital Research Institute, using CS&T beads for the first time to standardize our gamma delta T cell characterizations hadn't been done. It wasn't, white papers weren't written on it. So it's just been something that's been birthed inside of me and I've held on to for decades. And so I'm actually really excited to be here today once again, talking about spectral in the clinical environment, spectral cytometry. Definitely, Sony years and years ago had a vision for what this was going to look like. They're our key sponsor for today, bringing both Stacy and Paul out here and enabling their labs to do what they have to do. I know that BD also stepped up, partnered with us, Cytec, Beckman Coulter. So we see our industry partners and BioLegend coming alongside saying, let's do this, let's get together, let's figure out what next looks like. So I actually normally wing everything that I say up here, but I prepared some words just because I didn't want to get lost. But many of you know what the Bethesda consensus is. Some of you do not. 20 years ago, there was a gathering of practitioners, much like those in this room and online today, and they did something profound, something with lasting impact. It shifted immunophenotyping from a local art to a shared infrastructure. It formed a foundation for modern hematologic medicine. That shift enabled uniform risk stratification across sites, including the Children's Oncology Group, reliable multi-center outcome comparisons, faster translation to trial results into practice, and MRD-based therapy applications. And in that era, pediatric ALL survival climbed towards 90%. And that's only one of the success rates that we have. And this is not because antibodies cured leukemia, but it's because measurement discipline enabled therapeutic precision. The real lesson that we learned from Bethesda was not in the markers. It was in consensus, transparency, shared definitions, shared resources, and agreement on what good was going to look like. Bethesda proved something fundamental. When experts align on measurement standards, survival improves downstream. But that was 20 years ago. That work was built on technologies originally accelerated during the HIV/AIDS crisis, which we're not going to lie, there was a lot of political will to solve that problem. When scientists at BD and Beckman refused to accept the status quo, they were on a mission, they were relentless, they refused to settle for good enough, and yes, companies were born from that era. Many new logos that we see here with us today, companies that have gone on to build tremendous good and seed further innovation. So we must ask, with those two great foundations, scientific courage and consensus-driven standardization, are we going to do them justice? What are we tolerating today that future physicians will look at and say, how did they accept that? 10 to 15% assay variability is something that's come up in many conversations. Is that enough in clinical decision tools? Lot-to-lot reagent drift affecting antigen density readouts that are crucial right now for patients. Non-harmonized MRD reporting across institutions, that means we can't use the data collectively. How about delayed data sharing because of competitive positioning, sometimes in boardrooms where science is asked to leave the room? Manufacturers waiting to solve problems instead of doubling down to accelerate their solutions. Institutions guarding IP while patients face relapse. If survival is the goal, variability is our enemy. And disunity is the silent tax that we pay on progress. So those of us in this room, we stand on that Bethesda's foundation and the foundation from those willing to innovate for HIV/AIDS. And I just lost where I was in my talk. Give me one hot second. Somebody texted me. Yep. Okay. So the question is not whether or not we honor it. The question is whether we advance it. What if we work well with our industry partners to be clear about what's wrong and what we need to do better, to standardize antigen density reporting with chemistry level precision, establish benchmarks for tighter reagent lot-to-lot controls, precise reagents for precision medicine? How about we harmonize spectral controls and unmixing standards across platforms, maybe even across vendors? What if we share clinical assays learnings faster with each other and with the manufacturers who work with us? What if we collaborate pre-competitively on measurement infrastructure and we call the manufacturers to go beyond selling tools and partner with us in reducing any noise? Medicine must focus on healing, industry must focus on equipping medicine, and both must focus on the survival of the patient, which is at the end of everything we do. Most of us draw from the same funding pools. Those are taxpayer dollars, insurance reimbursement, and philanthropic grants. We steward public trust. So we must ask, are we building institutional advantage or survival advantage? IP matters, innovation must be protected, but IP is the tool, it's not the mission. The mission is to push back the darkness of disease, to see more mothers, fathers, sons, daughters, brothers, and sisters return home from the battles that they've won. So Bethesda did not eliminate competition, it created a shared measurement that has accelerated the flow cytometry industry. Let's remember that. It created a market. It created a language so competition could happen on therapy, not on assay ambiguity. We don't win when we're lost. That is the model. Pre-competitive alignment on measurement, competitive advantage on treatments. First, do no harm. That's what we say, that's what we're taught. In diagnostics, harm hides in variability. If the patient is our first consideration, then measurement from their cells must be worthy of their life. We do not compete against one another, we compete against relapse, against resistance, against mortality curves that demand precision. Alone we innovate, but together we cure, because actually the only competitor here is the patient. And who they're facing is the fiercest diseases of our times. We are here today to discuss building and improving measurement systems that fight just as fiercely. So with that, I'd like to thank FlowTex, right, for being an innovation platform. Time and time and time again, we show up year after year to have these crucial conversations that are archived, that are easy for me to say, go on YouTube, look at this one, go on YouTube, look at that one. So these are crucial conversations. The committee members who've enabled this, the vendors who show up time and time again to partner with us as we have these crucial conversations, we couldn't do it without you guys.